Healthcare and cancer care, they're not like a pin factory that Adam Smith used as his case study. However, opportunities and challenges remain as well. Opportunities because specialization can evidently improve patient outcomes, improve healthcare services provided, patient satisfaction, just to name a few. But it also poses a lot of challenges. For example, for recognitions, there are issues of training, education, accreditation, national, European policies, and this is just to name a few. Unfortunately, there have been efforts to the recognition of specialization nationally and European-wise. However, the evidence and the outcomes were not what we hoped for. But let's take things from the beginning and put things in context and into some kind of perspective. Having said that, let's see as the first slide what drives specialization oncology workforce. Better understanding of cancer through a better and improved understanding of tumor biology. The face of cancer has changed dramatically over the years, and issues such as the particular needs of specialized groups of patients have been placed at the center and the forefront of this care. The treatments of cancer care have become more and more sophisticated and complex, demanding high level of expertise to see this through. And the context of care, how it is organized today, is based on a model that is characterized by a multi-professional approach, an approach that takes into consideration complex needs, complex demands, complex treatment, which provides a multi-angle approach that is sufficient in order to provide a more comprehensive care. But this, don't be mistaken, these are only a few factors that have changed and shaped the face of cancer through the years. And I must say at this point that specialization holds a prominent position in this picture. And this is informed by the fact that the impact and the changes brought by specialization are now evidence-based. To this end, there are many examples in the literature that demonstrate that impact and that change in cancer care. So what I have done is that just randomly, I have selected a few examples to demonstrate this. For example, specialized surgeons within the gastric cancer patients' context, they have been associated to better prognosis and lower local regional recurrent rate. Specialization within breast cancer care in the screening era has been associated with significantly lower risk of dying, which is very important. Multidisciplinary clinic management has been associated to a better orchestrated this complex care, as we have seen earlier, always to the benefit of the patient and the healthcare system overall. Within the nursing profession, specialization demonstrates great impact on patient care, and taking prostate cancer, for example, as the focus of this discussion, we can see how the evidence clearly shows that specialized nursing care can contribute to the long-term quality of life and information needs of cancer survivors, contributes to positive experiences of patients with prostate cancer, and it helps fulfill the unmet needs of prostate cancer patients. And these are only a fraction of what it can do. Within other clinical contexts, specialized nursing care has been associated with improved patient knowledge and self-management and improved symptom management. The context of discussion on specialization can be described in what can be called the SEC model. SEC with the initials of safety, equality, and quality of care. To this point, I wish to bring into the discussion EONS experience in the field of specialization, laying down what have we learned from the quest of achieving specialization across Europe. This is the so-called RECON project. It's recognizing European cancer nursing which is led by the European Oncology Nursing Society and supported by ECCO. And we aim to consolidate the evidence to clarify the effectively position the contribution of specialized cancer nursing as an essential supportive function during the cancer journey for the benefit of all patients as well as European health systems. Very briefly, this is a three-stage project. It includes systematic reviews and data synthesis, focusing on the impact of cancer nursing on patient outcomes, experiences across cancer. Stage 2 includes documenting to what extent specialist cancer nursing roles are being regulated and the availability of specific educational requirements and opportunities in a group of contrasting European countries, 2 countries with specialized cancer nursing and 2 without. And stage 3, which is probably the most difficult one, is policy influence, putting all those evidence into practice and achieving a truly European recognition of cancer nursing. By utilizing the SEC model into this discussion as a framework, I will be demonstrating how the results of the Beacon project support this framework. For example, safety. At stage 2, an exploratory cross-sectional study of 393 cancer nurses completed a 12-dimension questionnaire about the hospital survey on patient safety culture in Estonia, Germany, Netherlands, and the United Kingdom. Statistically significant differences were found on 5 out of 12 dimensions. And at first, this finding might not say much. However, if we compare the findings between those 4 countries, between those with specialized cancer care and without, we do see that nurses, for example, in the Netherlands and the UK, scored higher on communication openness, the frequency of events reported, and non-punitive response to errors. So these have obvious implications in relation to patient safety in these countries. Equality. The RECAM project overall demonstrated that specialized cancer nursing is not unfortunately available across Europe. This has a negative effect on multi-professional care,